Hi, I am Dr. Sudarshan, consultant cardiothoracic surgeon at Fortis Hospital, Banakatta Road. I specialize in minimal invasive cardiac surgery. Now, what is this minimal invasive cardiac surgery? Whenever any patient is sent to us for surgical consult, the first and foremost thing which comes to his mind is what is the surgical risk, how long do I have to stay in the hospital, and how soon can I get back to work. Now, over the years, cardiac surgery has evolved to become one of the safest procedure with success rate of 95 to 99% for most of the procedures. Even today, we do most of the procedures by making an 8 to 10 inch incision in the midline and by dividing the breastbone and completing the procedures. At the end, we unite the breastbone by putting multiple wires. In the process, the patient has to take certain precautions for the whole duration of the sternal healing in the form of wearing a chest binder, not lifting heavy objects, and to avoid driving for this whole duration. Occasionally, we come across patients who have impaired healing of this sternal bone, especially those patients who are having uncontrolled diabetes, who are obese, who have poor immunity, and these patients have chronic pain, internal infections, and chest instability. The newer technologies have been evolved to avoid this morbidity in the form of sternal healing. And we have devised various procedures by which we can cut down this morbidity by doing partial sternotomies, while we can do the same procedures by dividing upper half or lower half of the sternal bone. By these approaches, the morbidities have come down to some extent, but not completely. And some patients do ask for no incision in the midline. So for these newer technologies, we have also shifted this sternal incision to one side of the chest wall. So now we do these approaches by doing a 3-inch incision to one side of the chest wall without cutting any breastbone between the intercostal spaces, and this is called the minimal invasive cardiac surgery. The advantages being the patient doesn't have any pain, there's less incidence of blood transfusions, there's less incidence of infections, the patient can get back to work within 2 weeks time as opposed to 8 to 10 weeks time earlier, and the hospital stay comes down to 2 to 3 days as opposed to 5 to 7 days. Now, what procedures do we perform by this incision? All the procedures of the heart, namely beating heart, coronary artery bypass grafting, the valve repairs, valve replacements, and ASD closures. Now, you may ask, why don't we offer this to all the patients? Now, all the patients are not fit for these procedures. We do come across patients who need multiple valve procedures, who are very sick and who need surgery on an emergency basis. So it is the surgical team who are the best to decide based on your age, medical records, based on the echocardiographic findings, to decide which approach is best for you. So in the end, I would say the mixed approach is the best approach, and it is the procedure which is safe and successful as opposed to by doing a minimal invasive incision. This World Heart Day, pledge to save yourself from the only life-threatening block. Block the block.